What are the normal ranges for different hepatitis B tests? I'm Dr. Bhargav Raut from Pathofast Lab Pune, and hepatitis B is a rather confusing topic because there are many different types of tests for hepatitis B. There are things like the HbsAg test, the anti-HbsAg antibodies, the HBE antigen, the anti-HBE antigen, and a whole host of other tests, each of which has their own function and their own different normal range. And today in this video, I'm going to make this very simple. What are the different tests for hepatitis B? Because hepatitis B is a viral infection that attacks your liver and can cause acute and chronic diseases. The virus spreads through infected body fluids like blood or semen, and making laboratory testing is probably the only way by which we can diagnose the virus. So blood tests are the cornerstone of virus diagnosis. So what are the different tests for hepatitis B? I'm going to enumerate all the different blood tests that are available for hepatitis B diagnosis. Some diagnose the disease itself, others monitor the disease, and some help us to tell whether you are immune to this virus. So the first line test that is done is the HbsAg test. Then we have the AntiHbs test, which tells us whether you are immune to the virus or you've been properly vaccinated. We then have the HBE antigen and the antibody tests, which are basically indicators of replication. We also have the hepatitis B core total antibodies test, which just proves that there was a past infection. And then we have the hepatitis B viral DNA load monitoring test, which tells us how much of the virus is currently present inside the patient's blood. So let me give you the lab reference ranges or the normal ranges in short. For the HbsAg test, the expected normal range is non-reactive or less than 1 S/CO. For the AntiHbs test, we say that you are immune if the value is more than 10 international units per liter. For the hepatitis B envelope antigen test, we consider a value less than 1.0 S/CO as being low infective. For the anti-HBE, that is the hepatitis B envelope antibody test, a value above 1 per SCO is considered to be a person who has never been infected or non-reactive, or someone who is showing high infectivity. But that is what you expect in somebody who was never exposed, or someone whose immune system is not working but has already been exposed. For the hepatitis B core total antibodies test, a normal range which is non-reactive is considered to be less than 1 unit per S/CO. And for the HBV DNA viral load test, a normal range should always be undetectable. Anything above 15 or 20 means there is considerable virus present in that patient at this point in time. Let's go into the expected results. Let's say that there's somebody who is healthy and has never been infected but who has been vaccinated. This is the usual situation that you find in most of the public. You have a negative HbsAg, your anti-HBs titer will be greater than 10, your hepatitis B envelope antigen and antibodies will both be negative, so will be the hepatitis B core total antibodies, and the viral DNA should be completely undetectable. Let's look at the expected normal ranges in someone who has recovered from the infection. So we have HbsAg as negative because there has been recovery. The anti-HBs should be greater than 10 international units per liter because we expect them to be immune now that they have recovered. The hepatitis B envelope antigen should be negative, indicating no replication. The anti-hepatitis B envelope antibodies should be positive because we expect that the body has controlled the infection. The core total antibodies will also be positive, indicating that there was an infection in the past, and the viral DNA load will be undetectable. We are now looking at the expected results in someone who is carrying the virus. So we expect the HbsAg to be positive, the anti-HBs titer to be less than 10 because this person has not been able to clear the virus. We do normally expect the hepatitis B envelope antigen to be positive if there is high replication but negative otherwise. We expect the anti-hepatitis B envelope antibodies, they could either be positive or negative depending on how well the patient's body is handling the virus. The core total antibodies will be positive because this person has been infected, and the hepatitis B viral DNA load will be greater than 20. Let's now look at the expected results or normal ranges of the HbsAg test. The hepatitis B surface antigen is a primary screening test for hepatitis B infections, and its positive results indicate the presence of the virus or potential infectivity to others. The normal range for the HbsAg should be negative, non-reactive, or less than 1 per SCO. A positive result indicates there is infection at this point, that is, the patient is currently carrying this virus. Let's now look at the second marker of current infection. This is called the HBV Dna viral load test. I've also done a detailed video on this, but this test tells us how many viral copies are currently present in the patient's blood. So what are the normal ranges of the HBV DNA viral load test? The normal range is undetectable. A level reported as less than 15 or 20 IU per liter does not mean negative. It means the virus is present, but in unmeasurable amounts. The method of detection is unable to quantify them below 15. The units are IU per ml or IU per liter. A positive test indicates that there is infection, the patient is carrying the virus. Let's now look at the hepatitis B envelope antigen test, which indicates high replication and increased infectivity. So what are the normal ranges of this test? The normal range in a person who has never been infected should be non-reactive or negative, that is less than 1 by SCO. In patients, a positive result is a bad sign. That means that the virus is replicating fast. It helps to guide treatment for the doctors. Let's now look at the marker of immunity, which is the anti-HBs antibody levels. Level of 10 is considered to be the cutoff for adequate immunity. So this test is used to detect immunity. Now, how do we measure a normal range in this test? So basically, if it depends on the situation. If you have been vaccinated, a normal range would be above 10 because we want your antibody titer to be above 10 for you to be immune. After infection and recovery, it should also be above 10. If you were never exposed to the virus, we expect this value to be 0 as a normal range, but definitely less than 8.5. The value of these titers may decrease over time as your immunity wanes. Let's now look at the anti-hepatitis B core antibodies, because these are the ones that are a marker that you were infected at some point in your life. They will always remain positive and will also be positive after recovery. So what are the normal ranges of the anti-HBC antibody? It should be less than 1, non-reactive or negative. If you have ever been exposed, it will always stay positive throughout your life. It does not confer immunity. That doesn't mean that it means it's of no use to prevent a subsequent infection. All it does is tells us that there has been an infection sometime in the past. Now let's look at the anti-hepatitis B envelope antibodies. These are the ones that appear when the hepatitis B envelope antigen disappears. It indicates that the body is combating the virus and reducing its replication. Seroconversion, that means this antibody becoming positive, is usually a good sign in people who have a chronic hepatitis B infection. Now, what are the normal ranges? In someone who has never been exposed, we expect the result to be negative. On the machine, this will show as greater than 1 SCO. In patients, a positive value is usually a good sign, means that the virus is not replicating, but a negative value is usually a bad sign. It means that the virus is replicating, and we expect the HBE antigen also to be positive at this time. It's a prognostic sign. It often shows improvement or worsening of the patient's condition and can be used also to titrate treatment.